Hi everyone, welcome back to Learn with MedNuggets. In today's video, we will be discussing how to manage an ischemic stroke. When a patient presents with stroke-like symptoms, the first thing you need to do is a non-contrast CT scan of the head. This will help you to identify if it's an ischemic or hemorrhagic stroke. It's very important to make this distinction at the start of the initial management because your treatment can change depending on the type of stroke your patient is having. For instance, if it's an ischemic stroke, you need to give the patient thrombolytics to bust the clot. But if it's a hemorrhagic stroke and you go ahead and give thrombolytics to your patient, he or she can bleed to death. With that said, the first step in the management of a stroke is to get a non-contrast CT head stat. And also remember, it's a non-contrast CT, not a contrast CT. Stroke is an emergency. Time is brain. Injecting contrast and taking a picture of the brain is time-consuming. So it's not the first choice when it comes to strokes. Besides, you usually do contrast CT scans to look for focal lesions or tumors of the brain. If the CT shows ischemia, the next question is what's the time since symptom onset? This is a crucial step in the management of an ischemic stroke because it determines what kind of drugs we can and cannot give to the patient. If the patient presents to us within 4.5 hours of symptom onset, we can go ahead and lyse the clot with thrombolytics. But beyond that 4.5-hour mark, thrombolytics have not been shown to be helpful. The next important timeline you all need to remember is 24 hours. If the time since symptom onset is more than or equal to 24 hours, not only is there a point giving thrombolytics, but also there's no point doing a CT angiogram in these patients. Because whatever damage that is done and is not reversible at this point. So in that case, the next step in management would be to give standard post-ischemic stroke management with antiplatelet drugs like aspirin and clopidogrel and to find out the source of the embolus, as in where the clot came from. Was it from the neck or the heart, etc. Now, if the patient presents after 4.5 hours but less than 24 hours from onset of symptoms, in that case, even though we can't give thrombolytics to this patient, we could go ahead and do a CT angiogram to locate that blood clot, and if there's a clot clogging up a large vessel, we can remove it with mechanical thrombectomy. We can also do the same thing to the patients who come to us within 4.5 hours of symptom onset. After giving thrombolytics, we can do a CT angiogram to locate the clot, and if there's a large vessel occlusion present, we can get rid of it with mechanical thrombectomy. If there's no occlusion, then we can manage these patients with antiplatelet drugs and investigate the source of the embolus. The key take-home points of this video is to remember the time since symptom onset. The first step is to image the brain to check if it's actually a stroke that's causing the symptoms. And if it is, and depending on the timing of presentation, give drugs to try and dissolve it. Then locate that clot with an angiogram. If the clot is occluding a large vessel, destroy it with mechanical thrombectomy. If there are no clots to be seen in the large vessels of the brain, give antiplatelet drugs to dissolve the small emboli and do tests to find out what is producing these clots and where it is coming from. This is a crucial step after the initial management. Common causes of stroke or emboli are atrial fibrillation, infective endocarditis, left atrial myxoma, paradoxical embolization via atrial septal abnormalities like a patent foramen ovale, atrial septal defect or aneurysm, prosthetic heart valves, tetralogy of Fallot, etc. If you can't find the cause, there will be another stroke. If there are any people here with us who are coming from a non-medical background, please make sure to come to the emergency department as soon as possible if you experience any stroke-like symptoms because time is brain. Thanks for watching. Have a great day.